What is the first sign of HIV infection? The first sign of HIV infection is opportunistic infection. Often, one of the first signs of HIV is enlarged lymph nodes, commonly known as swollen glands, in people infected with HIV, opportunistic infections. Most common cause of osteoporosis, deficiency of estrogen or um, hormones or androgens. The leading cause of osteoporosis is a lack of certain hormones, particularly estrogen in women and androgen in men. Sjorgen's complication, lymphoma. Sjorgen's complication, lymphoma, and another one is rheumatoid arthritis. Sjorgen's complication, lymphoma. What does OARS stand for in patient interviewing? OARS. What does it stand for in patient interviewing? O, open-ended. A, affirmation. R, reflection. S, summary. What does OARS stand for? Open-ended, affirmation, reflection, summary. Next, prostaglandin analog M has an effect on gastric ulcers. What is it used for? Something along those lines. Answer, non-steroidal anti-inflammatory anti-inflammatory all of the following are seen in chronic perio, except actinomyces. All of the following are seen in perio, in chronic perio, except actinomyces. Adult chronic periodontitis is usually associated with calculus, plaque, inflammation, and anaerobic organisms within the periodontal pocket. These organisms include Bacteroides, Fusobacteria, Porphyromonas, and Prevotella. In this case, however, the young age of the patient, and the absence of plaque and calculus in the in a if the patient is young and there's no uh, calculus, then the juvenile periodontitis has a site predilection for incisors and premolars. It is usually very fast in progression and not associated with high plaque and calculus levels. Its main cause is the organism Actinobacillus actinomycetin comitans, also mercifully known as AA. So the correct answer is choice A, because the question says that she's 17-year-old. A 17-year-old patient has periodontitis involving the anterior teeth with sparse plaque. And remember the patient that we saw the other day that had uh, periodontitis, and she wanted to know if she had an infectious disease, like sexually transmitted. She doesn't. She didn't have any infectious diseases. She had a periodontitis, and this periodontitis is, as you remember, the patient did not have a lot of plaque, and it was just caused by actinomycetin comitans. Next question. Okay, so the question had said all the following are seen in chronic perio except actinomyces V. Remember that actinomyces V is actinomyces V viridans maybe. Actinomyces viscosus is a gram-positive non-acid facultative. Actinomyces viscosus is a human and animal pathogen which colonizes the mouths of 70% of adult humans. It has a low level of virulence and is often mistaken back by actinomycetes. Actinomyces viscosus is gram-positive, facultative, anaerobic, rod-shaped, and filamentous. Causes periodontal disease in animals and has been isolated from human dental calculus and root surface caries, as well as oral cavity in hamsters. It can cause endocarditis in humans. So, next, a doctor does a full mouth series. A doctor does a full mouth series but charges patient for each individual radiograph. What is that? It's bundling. It's illegal. How does Benadryl or diphenhydramine work? Benadryl or diphenhydramine work? It works in motion sickness. Its clinical uses are allergy, motion sickness, and sleep aid. Benadryl. H1 receptor is a histamine receptor expressed in smooth muscles, vascular endothelial cells in the heart, and in the cerebral nervous system. Benadryl reversibly inhibits H1 receptors. So Benadryl reversibly inhibits H1 receptors. So the answer is, how does Benadryl work? It is good to be used for motion sickness. Next question. Rubella mental retardation. Rubella mental retardation. How is rubella mental retardation related? It's not genetics, it's not chromosomal, it is acquired. Remember that it causes panencephalopathy. The panencephalopathy, let's check what that is. Panencephalitis. Panencephalitis is a subacute sclerosing. Well, It is a chronic form of progressive brain inflammation caused by a persistent inflammation with measles. And the condition primarily affects children and adults. There is no cure for panencephalitis, and it's often fatal. The prognosis of panencephalopathy Okay. Next question. Patient who gets renal dialysis 3 days a week. When can you do oral surgery? The day after the dialysis. Next. Next, when do you apply chlorhexidine while doing a composite restoration? Something along those lines. You apply the chlorhexidine before you etch. Next. How do you sterilize gutta perca? You do it in sodium hypochlorite. Hipochlorito de sodio. The questions did not have glutaraldehyde in the options, which can. So, function of sodium hypochlorite, removal of necrotic tissue. Function of sodium hypochlorite, removal of necrotic tissue. Which is the least toxic to tissues? Answers are saline, sodium hypochlorite, hydrogen peroxide, or EDTA. Answer is saline. Saline is the least toxic to tissues. Next, alcoholic PT. What do you check before doing anything? In an alcoholic prothrombin time, you check the INR. INR. Alcoholic, what do you check before anything in alcoholic PT? INR. International Natriuretic Index. Oh, something like that. Patient who regurgitates. What do you see? You see erosion. Person who regurgitates. Erosion. Remineralization of enamel. Remineralized enamel. Remineralized enamel is non-cavitated. Other question says cavitated and needs to be removed, cavitated and something, non-cavitated but in close proximity to dentino-enamel junction. The answer is non-cavitated. Next. Side effects of codeine. Side effects of codeine potentiates the central nervous system, effects depression. Again, side effects of codeine, potentiation of the central nervous system, effects depression. As with any opioid drug, adjust the dose and regimen for each patient individually, taking into account the patient's prior analgesic treatment experience. In the selection of the initial dose of codeine sulfate, attention should be given to the following: total daily dose, potency, and specific characteristics of the opioid the patient has been taking previously. Reliability of the relative potency estimate used to calculate the equivalence codeine sulfate. Anyway, Serious side effects. Serious side effects of codeine associated with respiratory depression and, to a lesser degree, circulatory depression, respiratory arrest, shock, and cardiac arrest. Most frequently observed adverse reactions with codeine administration include drowsiness, lightheadedness, dizziness, sedation, shortness of breath, nausea, vomiting, sweating, and dizziness, sedation, shortness of breath, nausea, vomiting, sweating, and constipation. Other adverse reactions include allergic reactions, euphoria, dysphoria, abdominal pain, and pruritus. Other less frequently observed adverse reactions expected from opioid analgesics codeine sulfate, include cardiovascular system, faintness, flushing, hypotension, palpitations, and syncope, digestive system, which is abdominal cramps, anorexia, diarrhea, dry mouth, gastrointestinal distress, pancreatitis, and nervous system, anxiety, drowsiness, fatigue, headache, insomnia, nervousness, shakiness, somnolence, vertigo, visual disturbances, and weakness. Concurrent use of these other opioids, antihistamines, antipsychotics, anti-anxiety agents, or other central nervous system depressants, including sedatives, hypnotics, general anesthetics, antiemetics, phenothiazines, and other tranquilizers or alcohol, concomitantly with codeine sulfate tablets may result in additive central nervous system depression, respiratory depression, hypertension, profound sedation, or coma. Use codeine with caution, and in reduced dosages in patients taking these agents. Next. Um, which condition of an amalgam would make you restore it? Recurrent caries. Patient places aspirin in their mouth and has a bunch of white stuff in the cheeks. Why do you have these white spots? It could be hyperkeratosis if he does it. Dentist communication with the patient, providing an increasing set of numbers like 7% verbal, 35% tone, 55% nonverbal. Dentist communication with the patient, nonverbal, mostly. What is the result of a child taking antibiotics? Candidiasis. Storyline about a patient with steatorrhea, defective chloride channels, cystic fibrosis. What's affiliated with osteoradionecrosis? The mandible. The mandible is worse because it has more poor irrigation. And also more dense bone. What is common in patients with diabetes type 1? Blindness. Based on the CDC, what is the maximum amount of community fluoride? Based on the CDC, what is the maximum amount of community fluoride? Answer 1.2 ppm. What is the amount of fluoride recommended in a community? 0.7. What is the most likely to cause a pulpal response during tooth prep? Heat. When you're doing an implant, height work. Some new mouthwash that reduced the gingival index, but then the patient didn't have an increase in their overall oral care, something along those lines. That's a bias. Warthin's tumor is mostly seen with a benign tumor of the salivary gland. First symptom is usually painless, slow growing bump in front of the ear, on the bottom of the mouth, or under the chin. Warthin tumors may increase in size over time, but few become cancerous. Though the cause is currently unknown, smoking is believed to increase the chance of developing Warthin tumor. Treatment may consist of surgery to remove the tumor or carefully observing to watch the changes in the tumor over time. Uh, the most commonly place where it arises is the parotid gland. Approximately 5 to 14 of the 40% of the cases are bilateral, and 12 to 20 of affected people experience multicentric, more than one tumor which formed separately from one another. You can give a increase without treatment. The swelling may gradually increase over time, which can cause facial nerve palsy. So the parotid is the most common place where you get it. Thin tumor is mostly seen in the parotid. Next, serve out. You gave epinephrine, and what are the effects? The effects of epinephrine was heightened when taken with phenothiazine because of adrenergic receptor. Phenothiazine because of adrenergic receptor. Greatest margin of safety for a patient with renal disease, acetaminophen. Which has the greatest margin of safety for a patient with renal disease? Acetaminophen. Not fluorbinophen, fluorbiprofen, ibuprofen, or ketoprofen. When can you not do a gingivectomy? When it's apical to the crest. You do not do a gingivectomy that passes the crest of the bone. Next, drug that comes in troches, clotrimazole. Drug that comes in troches, clotrimazole. Fluconazole, a newly available triazole, has been evaluated extensively as a treatment for thrush. It has been effective in the treatment of this condition in patients with HIV. Clotrimazole troches have been a common treatment for thrush in patients with HIV infection for several years. There is a study that compares the efficacy and safety of fluconazole 100 milligram tablets once per day versus clotrimazole 100 milligrams troches 5 times per day in the treatment of thrush in patients with HIV. Patients were evaluated at baseline day 7, 14, 28, and 42. Okay, so troches for clotrimazole, oral for fluconazole. So the drug that comes in troches, clotrimazole. Clotrimazole. Drug comes in troches, clotrimazole. Next, difficult tooth surface to floss. The maxillary premolars. Difficult tooth surface to floss. Maxillary premolars. Next, what's the order for delivering a cast crown? What's the order for delivering a cast crown? Internal contact. Okay, what's the order for delivering a cast crown? Internal first, then contact, then the marginal integrity, then the occlusion. What's the common cause for porosity in porcelain? Inadequate condensation. What is the common cause for porosity in porcelain? Inadequate condensation. So what's the common cause for porosity in porcelain? Inadequate condensation. Next, repeated fracture of metal framework. Why? Poor framework design. Next, what does fluoride not do? Fluoride does not cause the pit and fissures to coalesce. Fluoride does not cause the pit and fissures to coalesce. Again, what does fluoride not do? It does not cause the pit and fissures to coalesce. Next, patient who swallowed a crown. You swallowed a crown. You took an X-ray. Where is the crown most likely? In the right bronchus. Right bronchus. Next, most common cause of amalgam failure, moisture contamination. Most common cause of amalgam failure, moisture contamination. Most common cause of amalgam failure, moisture contamination. An allergy to a crown is most likely because of nickel. Nickel is the most common cause why a patient would be allergic to a crown. What can base alloys be used for? So the question says, what can base alloys be used for? And we find that base metal alloys have lower density than type 4 extra hard gold alloys. This low density of base metal alloys makes the casting process difficult compared to gold alloys. Base metal alloys have higher resistance to deflection in thin segments, higher modulus of elasticity, and much higher melting point temperature, lower yield strength, lower specific gravity, and lower density. Advantages. Um, so So you have base metal alloys make the casting process difficult. They have high resistance to deflection in thin segments, and they have a higher modulus of elasticity. So they can be used in long span. Next, storyline about a guy who only had 4 anterior teeth remaining and was completely edentulous in the maxilla. How will the mandible look? Crown appear longer. Storyline about a guy who only had 4 anterior teeth remaining and was completely edentulous in the maxilla. How will the mandible look? Crown will appear longer. Because they super erupt. They will be super erupted. Super eruption. Next, contraindication to the use of nitrous, psychosis. Psychosis. Next, what's the effect if you give diazepam to elderly? In older patients, the drug greatly increases the risk of falls, broken bones, and confusion. It can also cause dependence and withdrawal symptoms. Next, what is not part of the 5 Code of Ethics? Competency. Next, what's a hemolytic malignancy that affects plasma cells? Multiple myeloma. What is a hemolytic malignancy that affects plasma cells? It can be identified by a punched out radiolucency for bones, a lateral skull X-ray is the best to confirm the multiple myeloma diagnosis. A cephalometric skull view allows you to see the punched out lesions. In the dental decks, you can see multiple myeloma is a disease of abnormal plasma cells that most often build up in the bone marrow. The cells form tumors in many bones of the body. It's 2 times more in men. Vertebrae, ribs, and skull are the most frequently involved. Patient in lumbar and thoracic region is commonly the earliest symptoms. Radiographic features are variable. Slight demineralization to extensive destruction. Characteristics finding in multiple small discrete punched out radiolucencies in both bones. In a patient suspected of having multiple myeloma, a lateral skull radiograph is best to confirm the diagnosis. Abnormal monoclonal immunoglobulin protein peak, known as M-spike, is usually the IgG and IgA class with a monoclonal light chain component. Urinary monoclonal light chain, so-called Bence-Jones proteinuria. Lateral skull radiograph is the best to diagnose multiple myeloma. So a lateral scope would be the most helpful in diagnosing. Next, what do you see in myocardial infarction but not in angina? Thrombosis. Thrombosis and myocardial infarction, not in angina. Angina, thrombosis. Next question. Patient who took oxycodone and developed hypotension and itching. Why? Because of histamine. It's a side effect. Histamine. Place denture in the mouth and then the patient places the denture in the mouth and then experience temporary salivation due to parasympathetics. Next, patient satisfaction with dentures. A. Dentist-patient relationship, bone height of denture fit, patient personal trait, technical quality of denture. The answer is cultural definition of aesthetics. Patient's satisfaction with denture. Which drug wouldn't raise a concern for period problems? Prednisone, methotrexate, aspirin, hydrochlorothiazide.